Thank you. Members of the Senate, it's been about 3 weeks since we debated this bill the last time. I thought it'd be helpful to discuss what's happened in these past 3 weeks. We already knew that there were 5 Republican governors, including Governor Brewer of Arizona, Governor Kasich of Ohio, who were endorsing expanding access to health care for their people. This week, we've now heard from 3 more Republican governors from Florida, Virginia, and today, New Jersey. Governor Rick Scott is a former healthcare executive who was elected because of his opposition to Obamacare. Here's what he says now embracing healthcare expansion for his people. I think this is a common sense solution to dealing with this for the next 3 years, where it will give us time to think about how we can improve the system. In other words, let's help the economy and our people while we improve the system at the same time. Today, Governor Chris Christie included expansion of health care in his budget to the General Assembly of New Jersey. Yesterday, Governor Bob McDonnell of Virginia supported expanding health care access to his people. One of the arguments that you all asserted 3 weeks ago was that we shouldn't expand access to health care because our neighboring states weren't, and that might attract more people to North Carolina who wanted to take advantage of Medicaid. Well, so much for that argument. What else has happened in the last 3 weeks? Well, a central argument you all raised was that expanding access to Medicaid would hurt rural hospitals because it would shift people from private insurance to Medicaid, and Medicaid reimburses at a lower level. And to support that thesis, you all cited a Harvard study that was national in scope. The fallacy of that argument, and really the central misconception of your case, is that you see there being two buckets of people. Those with private health insurance and those on public health insurance. Well, of course, there's a third bucket. 17% of North Carolinians have no insurance at all. Expanding access to health care will primarily serve to increase the number of people with health insurance, even if there is some movement from people with private insurance to public insurance. If somebody gets health care coverage in a hospital with Medicaid, they will by definition get reimbursed more than if they had no insurance at all. Look, don't take my word for it. Take the word of Steve Pizer. Steve Pizer is the author of the Harvard study that you all were so enamored with 3 weeks ago. He said, quote, North Carolina has relatively high uninsurance rates and currently restrictive Medicaid eligibility policies. This means that new Medicaid enrollees in North Carolina will be more likely to be uninsured than in many other states. The proposed Medicaid expansion would be an effective means to reduce uninsurance among the low-income population. Well, now that he no longer agrees with you, I expect you'll discount his opinion. Let's not take the word of the Harvard Law professor you cited. Let's ask the hospitals themselves. In a query from Senator Clark, the hospitals wrote, absent alternative coverage expansion, the decision not to expand Medicaid will harm your community's hospital ability to meet our patients' and community's needs, healthcare needs. Although already struggling rural hospitals will be among the first to manifest those harms, all community hospitals will feel the effects. We heard a lot that Medicaid was broken. Medicaid can, of course, should be made more efficient. We need to eliminate waste from the program. Over the last couple of years, on a bipartisan basis, we have in a number of ways supported efforts to eliminate fraud and waste from Medicaid. And we must never stop searching for ways to make that program more effective for the people and the taxpayers. But because Medicaid did not achieve the unrealistic cuts that you all imposed on them in the last budget, does not mean that this system is broken. In fact, between 2007 and 2010, North Carolina was #1 in the nation in having the lowest rate of spending growth of its state Medicaid program. Finally, we heard time and again that there's no such thing as a free lunch. I love lunch more than the next person. But I very much understand that you have to pay for your lunch. And so does Obamacare. What you're doing with this bill is saying that all the federal taxes that North Carolinians are going to pay to the federal government will not come back to North Carolina. No, instead we will send them to Arizona, to Ohio, to Florida, and now to New Jersey instead. The notion that you think you can solve the federal budget problem by rejecting federal monies paid for by North Carolina taxpayers is entirely misguided. The impact on the federal deficit of our little bit of share of our money, our own taxpayer money, is negligible. I expect when we see the state budgets that you all are going to bring forward in a couple months that we're going to send back about the 10 to 20 to $30 billion that we get from the federal government for transportation, for healthcare and education. I mean, my goodness, why should we take our own taxpayers to help with transportation if we've got a federal deficit problem? Our ability to solve the federal debt is a single raindrop in an ocean. Look, we know Congress is broken. Congress has to fix our federal deficit. But for us to reject our own taxpayer money is simply foolhardy. By rejecting federally funded healthcare expansion, we are failing to generate billions of dollars in economic activity when we desperately need it today. We are failing to create tens of thousands of jobs. We are failing to insure about 500,000 North Carolinians, and as a result, we are failing to save thousands of lives. Please reject this conference report.